I think the biggest finding really was that this is not just about workload volume anymore. So it's not just about the amount of work, but GPs described work becoming more intense, but also more fragmented and worryingly also more risk laden. So people were practicing with a higher level of risk. People talked about things like relentless duty days, increasingly complex consultations, more admin work, and because of delays in secondary care referrals, holding more responsibility across those gaps in the system, and especially where workload transfer were involved. So those are some of the challenges, but what the study also highlighted was what helped people stay in practice as well. So continuity of care, which is an area of research that I'm interested in, was incredibly important. But so were things like supportive teams in practice, having really clear workload boundaries, and on the ground good practice leadership, and having some control over how that work was organised. So I think that overall the results showed that retention depended not just on reducing that pressure of workload, but on the conditions that actually allow GPs to practice in a way that feels safe and meaningful as well for them as professionals.
What would you say to policymakers about that when you sort of realise that continuity is so important to GP retention?
Yeah, I think unfortunately the way that things are set out often in terms of this sort of access versus continuity debate, they're set at opposite ends of a spectrum that, if you're offering continuity, you can't offer good access. And I think a lot of research coming out from Manchester, Jennifer Voorhees has done some work around this, is that actually offering better continuity can improve access. And for the GPs we interviewed, continuity wasn't sort of a luxury or optional extra. It was actually central to what made general practice meaningful and clinically manageable for them and their patients.